Hi everyone, I'm Tammy Stadt. I'm an individual living with EDS and I'm on the ILC board, and I want to talk to you about building your care toolkit and what is known and unknown about EDS and chronic pain from my perspective. So disclosures. I've received no commercial support. Mitigating potential bias is I am an individual living with hypermobile Ehlers-Danlos Syndromes and its comorbidities of mast cell and Q9 Aquinas syndrome, to name a few. I'm a health advocate who volunteers as an ambassador for wellness and peer support, the ILC Client Navigators, and as well a board member with the ILC Foundation. Some of the content has been shared previously at the Health Quality Ontario Healthcare Transformation in 2018 in my presentation of our population, applying the lessons of improving care for patients with complex needs to other populations. It was a great opportunity to speak to the medical community about lessons learned and also to provide some knowledge about EDS. So, my care team. So you see me there in the middle. As you know, managing Ehlers-Danlos or any other heritable connective tissue disorder and chronic pain, it's complex. We're complex. And my care team involves multiple specialties and allied health professionals. And in 2016 through 2017, when I was dealing with the onset of my Q9 Aquinas and trying to engage in obtaining neurosurgical care, I had over 30 medical professionals engaged in my care. So with it in the year, there was 30 different medical providers that were engaged. And with it, the lesson is that they need to communicate when their treatment recommendations overlap or sometimes conflict. And so if you look at who your care team is, think about how you pull people together and how you share information. So that's a lesson I learned. Having a rare, or as I like to say, rarely diagnosed or underdiagnosed syndrome is having a full-time job. Identify who's coordinating your care. Is it you? And if it is, how are you going to keep track? And how are you going to manage? And think about it. You're trying to reduce the burden on the healthcare system through self-management, but you're also trying to take care of yourself and advocate for yourself. And we're going to talk a little bit more about that. So why plan ahead? Brain fog and pain insomnia impacts us on a regular basis. It's pretty bad when you can't answer the question because of the fog, or trying to remember important medical details. In an emergency or at a long-awaited appointment, you need to have notes to guide you. And also bring someone with you. When we are struggling to think or putting our words together, we need to depend on each other. We need to support each other. And as the thing there says, pain, insomnia sucks. And with it, we've all been there. So let's be kind to each other and kind to ourselves by planning ahead. So one of the tools that's used is a health resume. And when I switched healthcare providers, my primary care provider, my family physician, I made a PowerPoint health resume that I sent to my doctor and printed out. And with it covered all the important details, which I'm going to cover here with the health resume. And all of these tools will be available on the ILC website for downloading, so the template for the health resume and other resources I'm going to share today. So the health resume, what things that you've been diagnosed with? What conditions? Have you had surgery? When was that happening? Who did it? Who diagnosed you? And what location did you have the procedure? So with it, I know I had surgery at 5 years old at Sick Kids. Well, with it, if they want to go back to get the records, now it may be a little late, but for some of you, if you've had procedures done, being able to have that information to share. and known allergies. So environmental, food, medications, it's important to know. And what is the severity? And what are your symptoms? And how do you manage it? So I'll show you when we get to the medication list. I actually list my allergies to medications, and I list an A beside it for anaphylaxis and an S for sensitivity. So it's things that just make my stomach yucky, or causes my bowel to react, or I get the prednisone mask, which looks like I'm sunburned on my face. It's not nice symptoms, but with it, it's tolerable symptoms. It's not the point that it's a true allergy. It's just a bit of a reaction. So, healthcare resume. Who's your care team? Who's your primary care provider? Do you see a nurse practitioner? And then what specialists you see? When did you see them last? When are you scheduled to follow up with them? What are the care plan? What's the goals you have for that practitioner? And the key for having this listed is whoever you're seeing knows who the other players are. They can consult with that practitioner and be able to follow up, especially when you get competing information. I had a urologist tell me I was drinking too much water, and I had a GI doctor tell me I wasn't drinking enough. Either way, I wasn't going to be compliant with their medical recommendations. So I was able to say, you two need to figure it out and let me know what you guys decide as the medical professionals. But either way, the way it stands now, I wouldn't be compliant with your treatment recommendations. So let's come up with a plan together. And with it, don't forget about your allied health people, your occupational therapists, physiotherapists, speech language pathologists, social workers, psychotherapists, nurse practitioners, dietitians, massage therapists. They're all part of your team. So let's acknowledge them and have your list. So the next piece on the resume is making sure you have your medicine. What pharmacy do you use? And with it, having a rapport with your pharmacist. So with it, letting them know what medications not to prescribe to you, because there is some ones that EDS patients don't tolerate well and actually can increase our dislocations. So it wasn't until I communicated with other EDS patients that I found out that baclofen is not recommended for EDS patients. After my shoulder, my elbow, my wrist, and my knee were all out on my right side of my body and needed adjustments. So with it, having that knowledge in advance and sharing it with your pharmacist. Social history. So what did you do for work? Are you still able to work? What's your living situation? Do you have support? Are you in assisted living, in a group home, long-term care? Or do you have family that supports you in your daily activities? What are your primary supports? I'm aware of a couple of EDS patients that moved in together because one can look after the other when they're having a bad day, and they fully understand and support each other. Medical power of attorney. Who's responsible for medical decisions if you can't make them? A lot of the provinces have a document that you can download and fill out, and it covers also the financial, and it allows you to have that in advance and share it with your doctor, and also with the people that you would like to make decisions for you. We'll talk more about that in a little bit. Also describe your living situation. Are you in an apartment, a bungalow, townhouse? Do you have stairs to get in and out? Do you have stairs to get to bed or to the bathroom? Those are all important things, because if your mobility is decreased, how are you coping with the daily activities in your home? And then with the equipment in the home, so grab bars, stair lifts, ramps, commodes, with it, getting a consultation with occupational therapy, because with it, how do you make your living situation better for you to make your journey better? Sources of income and financial support. So are you working? Are you on ODSP or OW? Are your parents supporting you? Are you supporting children, a spouse? The reasons for those kind of things that you should be sharing is one version of the medication may be covered under the provincial drug plan, but the other version may not. So with it, the provider needs to know if you're on, let's say, Ontario Works or OW, or ODSP here in Ontario, because gabapentin is only covered in the 300 milligram capsules, not the 600 milligram tablets. And for me, I was allergic to gelatin, so I couldn't take the version that the government covers. So how is there funding to help support you in obtaining the medications you need? Do you have access to health insurance? Do you have funding? Those are important pieces as well, because you never know with the cost of medications. So for my mast cell, I had to go on Xolair because I had a reaction to Zantac, a histamine 2 blocker. So as a result, Xolair, for the dosage I need, which is 2 vials every 4 weeks, is $16,000 a year. How do you manage that if you don't have funding? Or it's not covered at that point by benefits or through the provincial plans. So it's helpful to be able to have that conversation with the practitioner, or you don't have to have the conversation. It's there on paper and that they're aware, so that they can also advocate for you, because sometimes you may need additional supports, or you may need special equipment, and they can do the applications for you. So the other piece, so we started talking about devices, so mobility devices, cane, walker, wheelchair. Now just a cue there, walkers are not recommended for EDS patients because it does increase the stress on the shoulders, and they recommend actually using forearm crutches instead of a walker. Though I know myself, I found a walker was great because if you need to sit, you can sit. And then with it, the date you received it, because mobility devices, I know some provincial funding systems allow for replacement every 5 years, and if it's needed prior to that, there is a shift in the amount the government will pay for their percentage. So in Ontario, the assisted device program covers 75% of assisted devices such as a walker, wheelchair, and with that 25% you're responsible for. If it's before the 5-year point and you need to replace it, you're paying more than the 25%, at least in Ontario. So it's good to check in your province, and I'll show you some resources to help with that. What's your functional status? Are you independent? Do you need assistance? Are you dependent on someone else, or is it not applicable? Need to include a needs description when applicable. So meal preparation. So with it, I'm good except for when there's heavy pots. Grocery shopping. I can manage it, but I'm going to have to rest for a while. Money management I'm good with. Medication management. Brain fog. So with it, we're going to talk about some apps and supports to assist with that. Home management. So who looks after if you're in a place where you have to deal with snow removal or with cutting the grass? Do you have supports for that? I used to be able to do it. Now I can't do it at all. So with that, communication. So with it, do you need to make notes? Do you need, because of brain fog, do you need to record so you can go back to it? Comprehension. I find sometimes because we are in tune with medical information and we're great at reviewing medical journals and obtaining information that way, sometimes with it, practitioners forget that we are lay people because we know the medical terms. So with it, sometimes doing a reminder, I sometimes will need you to explain terms because I don't comprehend them. Memory, and then self-care. So getting into bathing, hygiene, grooming, dressing, toileting, eating. Myself, on a bad day, I may not be able to use the washroom on my own, or my bladder doesn't want to cooperate, so I'm having to cath. So what resources and supports do I need for that? And having that conversation in advance with the medical providers or your family members. Thinking about transportation. How do you navigate the community? It's important for a medical provider to know that, you use a mobility device and you'll need to take that with you, because there is transportation programs that you can be referred to, or with it, are you capable of driving on your own? So myself, I have my practitioner check the strength of my legs because I drive on my own, and with it, a tip I'm going to give you is CYA, cover your butt. So with wearing AFOs when I'm driving, I have my doctor or physiotherapist check my leg strength. So if I ever get in an accident, they can't say that I didn't have the strength and the AFOs were affecting my ability to drive. What leisure activities do you like? And then thinking about your nutrition and dietary needs. So myself, I have oral allergy syndrome with my mast cell. So eating fruits and vegetables is a challenge because it increases for me hives and triggers my asthma and seems to do a cascade through my body. So with it, how do I get enough vitamins when you can't eat? Some of the good things they recommend. And sleep. Do you have sleep hygiene routine? And then with it, what annual cares and tests do you need? So echocardiogram, checking for aortic dissection. Eye exam. So with it, a lot of heritable connective tissue disorders, including EDS, can obtain yearly eye exams. So in Ontario, they went to every other year, though, HIP covers. Well, with it, with the doctor's note from your primary care, in Ontario at least, they cover a yearly exam. So something to think about, and also cue your medical provider to think about, because they're learning too, and EDS in medical school is usually one slide, unless there's somebody there that is living with it. So with it, be kind to your practitioner, give some cues as well. So medication list. So I have, this is the template that I use. So I have medication schedule and I have my name on it. And then I list the medications and the reason for use. And the directions for taking it. So I'm taking it once a day, twice a day. And then what time am I taking that medication? And then with it, I also make sure I put in when I last updated the list. And I carry an extra one in my in my purse. So when I go to an appointment or I go to Emerge, I can give them a copy of it and I don't need to write it all out. On the back side, I have who to call in case of emergency. Under the care of, so I list my doctors, and I reduce the list for this purpose. What conditions are you being treated for? And then I have on here a description of what EDS is, and connecting them to the ILC and the Ehlers-Danlos Society. And the reason for that is I don't want a doctor to have to go and Google about my condition. I want to be able to provide it and then give them valid resources to go to. It's important that it's a quick look at it, because with it being on my medication list, if I have to be taken in by paramedics, I can give them that and they can see how they need to handle me with care. And then here I list, as I said, the allergies and drug sensitivities. And with patient portals that are becoming available, I discovered that they listed acetaminophen as an allergy, but I take it on a regular basis, and it's because it's a component of another drug. And with it, they wouldn't give me a Tylenol as a result. So you need to look at making sure that the practitioners also have the correct information. And that's you being an empowered patient. So the other thing I do is practitioner updates. So I keep on my laptop, on my desktop, I keep a Word file, which is an update, medical update, and I have that available to put my self-report. So we'll be providing the template as well. So place for my name, what doctor I'm seeing, and a date. Anything I want to cover in the appointment. So what's my current issues? What's the reason for my appointment? Since my last appointment, what changes have occurred? Changes in medication? Do I have any new allergies? Current symptoms and other upcoming appointments, upcoming tests, reminders for tests to be booked or followed up, and other practitioner appointment updates. So from doing this, I was listing some symptoms I was having, and with it that wasn't the reason I came to see the doctor, but the doctor seeing those symptoms decided that was more of a priority. And with it, it's also looking at saying, this is the reason I came today, but this is what else is going on. Because most practitioners don't have time to deal with the laundry list of things that we may have. They're dealing with one issue only. And what you think may be the priority may not be what they think the priority is. So recognize that, accept that. But then with it also think about asking for an additional time for an appointment. And also asking that this is uploaded to your chart. Because with it, they can see the progress in maybe that you may not be able to see. So you may have improved your mobility. You may have improved your management of your mast cell or your GI issues. And it just allows them to look back and see the progress as well. So creating a plan. When you see a medical professional, remember to ask, how can I self-manage my symptoms? When should I follow up with you? And when should I seek medical attention at the emergency department? We all hate going to the hospital. And I know from being involved in the Facebook groups, somebody will post, this is what's happening. Should I go to Emerge? With it, when you can, check with your medical practitioner. So my doctor always said, if your bowel, your legs, your bladder stop working, go to Emerge. And with it, telling them at Emerge, I'm here because my doctor said if this happens, I'm to come here. And the reason why. Have the plan written out to ensure you're both on the same page. And share it with other practitioners in your care team. And care plans also help in advocating. And keep a copy on a USB key or in your storage, cloud storage, so you can access it when needed. And that's a key point, because if you go to Emerge and you give them a copy of your care plan, you may not have another copy of it, and you may not get it back. So with it, it's good to have a backup, even if you take a picture of it or you ask the doctor for additional copies. Okay. So new to self-management. So the book Disjointed, which has a lot of information on navigating the diagnosis and management of hypermobile EDS and hypermobility spectrum disorders. It's a great resource by the different symptomology that you may be experiencing. And the other one is Living a Healthy Life with a Chronic Conditions, and it is the Stanford model. And this program is offered free across Canada. A lot of the health organizations, ministries across Canada saw it as a beneficial aid in teaching people to manage their chronic conditions. And if you have EDS, you've probably already been doing a lot of the things that are discussed. They also have a chronic pain series as well, What I found beneficial was it gave the opportunity to connect with other people experiencing it. It may not be EDS, but other chronic pain conditions, and it was good to get some ideas and tips from other people as well. So preparing for virtual appointments. So check any emails that come from your healthcare provider. Complete and submit any required forms before your appointment. Ensure your device is charged. If required, download any software required for your virtual appointment. And try to be 15 minutes before and 30 minutes after your scheduled appointment. Be available, and if anyone else is joining your appointment, such as family, caregiver, ensure they have the link and times as well. Virtual appointments were great during COVID because for EDS patients, it made it so that we didn't have to travel, especially on a pain day. And it's like myself, I live an hour and a half from some of the medical professionals I see. And just having to travel that distance really wears you down. And so that way there you can be comfortable at home, having the appointment, and being able to still obtain your healthcare needs. I'd like to give special thanks to Canada Health Infoway for their tips for virtual appointments. So what to bring to your appointment? Have your health card. If it isn't a photo card, additional photo ID, especially if it's the first appointment. Information regarding your condition, list of symptoms, and any health record data, weight, temperature, blood pressure. With it, I did a dermatology appointment by virtual appointment, so I had to have photos, and I had to point out where they were in my body, and that information, and what they looked like, what they felt like, were they warm, were they cold, just so that the practitioner, when he was looking at it, was able to give me information back on what it was and what the treatment was. If it's the first one, also have your health resume available. If it's a GI doctor, well, what happens with your GI system? Eyeglasses, hearing or walking aids if you need them, pen, paper, and other tools to take notes. During the appointment, if it's the first one, log in, again, 5-10 minutes before the meeting. Be prepared that you may have to wait online before the practitioner lets you into the virtual meeting room. If the appointment's over the phone, make sure you're able to answer the call. Don't plan on running your errands and think that you're going to stop and answer the call when you're in the grocery store. And with it, the phone call may come from an unknown or blocked phone number, and they do that for your privacy. But with it, I know I'm not big on answering the phone if I see that, but when I know I have an appointment, I answer. If asked by the practitioner, they may want to confirm your location, your health card information. They also may want to make sure that what's happening in the background. Do you have privacy for the appointment? Is there other people present? And with it, if you're doing a video appointment, remain in front of the camera and speak clearly. I know that's a challenge for me at times, so just something to think about. After the appointment, if the practitioner shares a summary of the visit following the meeting, review the summary and ask the practitioner if there's anything unclear or incorrect. And you have the right to ask for corrections to the record as well, or the notes that come. And the reason for that is you wanted to be having valid information. So I received back after a gynae appointment that the gynecologist decided that they would not operate on me, and the case notes that came in had the wrong blood type, had that this practitioner was seeing me in the OR next, and also the wrong allergies, which really meant I got somebody else's case notes, and with it, that would have been part of my permanent record. So with it, I requested a correction. I got the proper notes from the appointment, and that was what went into my record, and the other one was removed. So with it, there is the QR code you can connect with Canada Health Infoway, and with it, they actually shared this resource with connections with Canadian Medical Association and Sunnybrook Health Sciences. Lessons learned: be an empowered patient, be an active partner, and build on your own resilience. We all have our own strengths. Build on those. Use care plans to assist in self-management, and use technology such as apps to track your health changes. So this is my blood pressure app. And so with it, with when I took my blood pressure, my doctor can see where I'm at and how often. And I could actually print it off and share it with them. So apps. So with it, the ILC had partnered with Chronically Simple, and I've also recently discovered Health Espresso, and both apps actually manage your communications. So with it, Chronically Simple allows you to upload doctors' reports, consultation reports, fill in your information, what medications you're taking, etc. Health Espresso is slightly different. It also allows your practitioner and you and your other practitioners to have a shared platform for information. So with it, the reports that are available from, let's say, UHN, I would be able to access them and I could save them to Health Espresso, and my family doctor could also access. So with it, it's a shared information of me, and with it you can manage who has access, and that both of those are Canadian. Manage My Pain, so I've put the logos there so you can find them in your app store. Manage My Pain Pro gives you a template where you can put in what's your current pain level, where is the pain, describe your pain, what's working, what's not working, and when did it resolve. So with it, I was able to see that I had this ongoing pain, and it seemed to be happening more every Saturday. Well, what's different on Saturdays? I go grocery shopping. So I'm doing something there that seems to flare my pain. So how do I adjust? It also is great because I can track how often I'm taking my PRN meds, so that I can say to my doctor, I'm taking my breakthrough pain medication on average 3 times a week, and this is how much I'm taking. The ICN food list, it's great for tracking the histamines and other key allergens that may trigger you. I know for myself with my mast cell and oral allergy, it's helpful for me to see what foods I should need to be avoiding because it triggers my reactions, but also with it information for other food products you may buy at the grocery store and not even realize. The next one I also use is Access Now. It has maps and locations, and with it will tell me, is there stairs to get in? Is there a ramp? Is there an automatic door? Is there a wheelchair accessible bathroom? Nothing worse than going out to eat and then discovering that the bathroom is down a flight of stairs and you can't access it when you need it. So Access Now allows me to plan ahead for when I'm going out. Use a password manager. I use Bitwarden, and with it, I only have to remember one password. My fingerprint is my other key access on my phone, and with it, it saves all my passwords, and it will generate passwords. And I don't have to remember those. I only have to remember one, and it reminds me maybe it's time to change your password. And even PIN numbers, being able to remember, okay, well, the access for the side door, because I have touch tone, it's a 4-digit PIN. Well, I never go in the side door because there's stairs, so what is it when I need to access it? I also use apps to keep track of my blood pressure, pill reminders. So with it, it's great to have apps that will actually remind you to take your medication, and then also record how much you're taking and when for over the counter. And then smartwatches for tracking activity, but also with it, they're great for also alarms. So with it setting up on your phone, to tell your smartwatch to remind you, vibrate at 10 o'clock because you need to take your pills. It's a great thing to do. I found another great watch, and it's called the Attention Deficit Watch, and you can buy it online. It looks like a regular watch, tells time, but it will vibrate with reminders. So reminders that, okay, well, it's time you need to use the bathroom. You gotta drink some water. Time to take your medication. So with it, you can pre-program it, and is this little vibration, and so it cues you. And I found it was very beneficial because it also reminds you to do things like, it's time to meditate. It's time to take a break. Those kind of things. So another thing with self-management is thinking about food allergies, medication, anaphylaxis, UTI prevention and treatment, self-cathing when required, and asthma action plan. So you can see there in the picture, they had to put 2 hospital allergy bracelets on me for an ER visit, and that was because just being able to put all my allergies on there so that they were aware, and I double checked that they had recorded all my allergies. The other important thing is when you make a self-management plan. So for example, when I made mine for UTI prevention and treatment, with my urologist, it was, you're going to drink X amount of water a day. You're going to go to the bathroom every 2 to 3 hours while you're awake. And with it, I saw a pelvic floor physiotherapist for how to help me make sure that I'm emptying my bladder completely. And the pelvic floor physiotherapist gave me some great techniques, which allowed me to reduce the amount of urinary tract infections that I actually have. Self-cath. So with it, unfortunately, if you have issues with your spine and the nerves, I know I had to be taught how to self-cath when it's required. And I discovered that because I'm right-handed and my shoulder acts up, how do I do that when I'm having challenges with subluxations and dislocations? Something to think about and have those conversations. So asthma action plan. So it, for me, was a tool. So with it, I was into the yellow zone, and I prepared this with my allergist. And then with it, when I got to the red zone, it was for me to go to emerge. And with it, I went to emerge and I explained what was happening. I was maxed out, couldn't catch my breath, I just kept coughing. And with it, I was maxed out on my reliever medication and I needed help. But I had no fever. And that's one of the issues sometimes with dysautonomia, is sometimes you don't have a fever, or what is a normal temperature isn't a normal temperature for you. So in my case, my normal temperature is usually around 36.2, 0.3. So with it, when I was at 37, for me that's a fever, or anything over 37 is a fever. And I had to actually have a note from my doctor in event of having to go to emerge, just so that they knew that that was not my normal. And then with it, having this plan, they had checked my oxygen saturation rate. And when I finally saw the doctor, my oxygen saturation rate and no fever, the doctor said I was actually breathing better than he was. But I just couldn't catch my breath with the coughing. So the doctor gave me an x-ray to check my lungs, see what was happening. Because he thought it was viral and wanted me to go home. But because I had this plan, I was able to say, no, look, I'm in this zone. I need help. And from that x-ray, they discovered that I had double pneumonia. I had pneumonia in both my lungs. And with it, if it wasn't for that x-ray and the asthma action plan, I wouldn't have been treated. And with it, the coughing can cause a lot of stress on our spine and on our ribs, and with it can actually make us put things out. So with it, being able to advocate to get the care that we need. So for me, that was a key tool that I had in my toolkit. So other self-management. So think about skin, wound care, bracing, taping. So here you see my ankle foot orthotic. If you have to wear it, make it blingy. I'm wearing my stripes. Bracing and taping is key. Ask your physiotherapist, show you how to tape. Having your pain management plan. Having a plan for subluxations and dislocations. Insurance. On your medical devices. So in my homeowner's policy, I added my wheelchair to it, and with it I hit a curb with my wheelchair, and with it, it was fully covered by the insurance. It was $4,000 worth of damage I did to the suspension on the wheelchair, so it wouldn't move. So with that, the insurance covered that. And also self-management, think about volunteering. What are you doing to reduce your isolation? All of us have great gifts and talents. Why not share them? So I'm going to talk a little bit to you about social prescribing. So another piece of self-management is planning ahead. So I got my tape for doing my bracing. So I love the TheraBand brand because the little hexagons change shape, so you can see whether you got stretch or no stretch on those components. I use the Thermal Care heat wraps on my back. I can tuck them in. Gives me some heat. It's just radiating back the heat from my own body. Arnica, great for putting on bruises, but don't put it on open skin, especially if you have a ragweed allergy, because it can actually cause a bit of reaction. And like I said, what may work for one may not work for all. I also have wound care components, so I have the Tegaderm, so with it to cover over wounds, and my Fusidin, which I carry with me, so I can actually put some antibacterial, similar to polysporin, on the wound after I've cleaned it and cover it. And then on the right side is what I refer to as my oh shit kit. So with it, you can see my medication list there at the top. And behind that, I also have my cath kit. I have additional Reactin. And I also have my oral allergy and my Handle with Care. I have my 2 EpiPens. I got a hand sanitizer. I got my Ventolin, and I have a USB key. And that USB key is there for me to use with health journal articles, but I also have copies of my care plans on it. So with it, I can actually provide it to them, but it's also good to have it on your cloud. And I carry this in my purse all the time. Lessons learned. Bring a friend or a support person to appointments where emotions and brain fog are running high. Nothing worse than getting to an appointment and you're very emotional. Your friend can support you and help make sure that what you wanted to address that day gets communicated. Encourage wellness and prevention. So there I am in a therapy pool that is 93 degrees Fahrenheit. Sorry to all my potsy friends. With it, it allows me to get some relief of pain. I'm able to walk in the pool, and with it, I was attending a range of motion class. So I got to learn what was normal. And the classmates would be like, "You're putting that arm a little too far. That's not normal." So with it, it trained me to start getting that memory of muscle memory of how far is too far. So this is normal range of motion. Oh, stop, you're going into the abnormal range. So I did that pool class 3 days a week, and with it, it really helped me out. Though I know some of my friends with POTS, the water temperature can be a trigger. Continue activities that you enjoy. What gives you joy? And you need to look at that. Because if we're just dealing with EDS every day, it can wear you down. So what are the things that are the good things in your life, and think about those. So for me, I love gardening. I grew up as a kid going to my grandparents' farm, and my parents had gardens. So with it, I missed that. So when I couldn't garden, as my health declined, I would just visit garden centers to explore the plants. I'd wheel around, smell the, feel the rosemary and smell it, and checking out the flowers, those kind of things. And then I started to container garden. So in a container, such as you see there with my little peppers on the railing, I had planted tomatoes and peppers in pots, and I was able to harvest from that. And then with it, my husband created wheelchair accessible raised beds, and the guard there is to keep the dog and the rabbits out. And with it, I'm able to reach, and I'm there harvesting the beans from the stalk. And with my mast cell, I can't eat it all, so I donate to my local community food programs, but it gives me that joy. And with it, think about the joy. So intimacy. It can be really hard with chronic pain and with any disability. And with it, I love Come As You Are. It's a store in Toronto, in Kensington Market, but the online. They have devices and educational information which can support you in navigating intimacy with your EDS and chronic pain. And I'm just going to say this, remember lube, as it will reduce skin trauma. So preventing tearing, preventing chafing and sores. And it's also have the conversation with your partner about intimacy, because it's challenging, because they also are afraid of hurting you. So having the conversation about intimacy and what works and what doesn't work, because it's challenging, and with it, it's also challenging for them as well. So chronic pain. I kind of already said this, what works for one may not work for another. By using apps such as My Pain, Manage My Pain, I can tell what works and doesn't work for me. So heat and cold. I know with cold, I go into spasms. Bracing and taping. Sometimes I need to tape because a brace is a little too intrusive, or can be just as irritating. Rest or activity. There's some areas in my body where pain I need to move versus resting. Distraction or mindfulness. We're not all wired the same. So with it, finding what works for you. Medication. Pain clinics are very important to look into. And then also massage therapy, physiotherapy, chiropractic, or osteopath. And in my case, I also went and saw a traditional healer. And with it, finding what works for you. So chronic pain find those allied health, massage therapy, physiotherapy, chiropractic, etc. before you need them. So for the first visit can be a conversation about you and your needs and understanding. Do they have experience with other EDS or connective tissue disorder individuals? Obtain recommendations from your fellow zebras and place your vanity aside. Use your cane and crutches and braces, such as digi-splints, which actually are beautiful, or your ankle foot orthotics. So with AFOs, it was recommended to me in my early 20s to get them because I kept rolling my ankles, pronating. And with it, I didn't see them as something that I would feel comfortable to wear, and it felt like I'd be embarrassed to wear. So I didn't get them. But I ended up years later, when my patella kept subluxing, I ended up getting the Dawn Joy titanium braces, which were even bigger and bulkier. And they wouldn't stay on, no matter who put them on, whether it was the physiotherapist or the gentleman that did the bracing for me. And with it, they just kept coming down. And it wasn't until I saw a physiatrist with the gentleman that does bracing, we discovered that the lower half of my leg mechanically torques as I walk, which is why the ankle pronates, but it was also adding stress to the knee. And with getting the AFO and getting it put on properly and putting the vanity aside, and I decided to go, let's go stripes. I want to be a zebra. I want to be part of this dazzle. I got it, and it reduced the stress on the patella. It stopped the ankle subluxations. It stopped the sprained ankles. And with it, it relieved my pain. So we need to think about those things as well. So chronic pain. I went to a conference in the US. They talked about trigger point therapy. So I got this book, and with it, it gave me trigger points for repetitive strain injuries. And with it, my husband and I, where I can do them, do it, and it reduces my pain. The book on the right, Grouch, Pain is Like a Grouchy Bear. This was shared at an ILC conference previously, and it's a great book for children to explain what chronic pain is. I went through it with my granddaughter, and with it, she knows that sometimes I'm the grouchy bear, and she needs to just be cautious. But with it, it gave her the understanding that she needed. Mindfulness meditation. So mindfulness is a type of meditation that focuses on being intensely aware of what you're sensing and feeling and in the moment, without interruption or judgment, and involves breathing, guided imagery. You could go for a walk in the forest and do a mindfulness meditation. Other practices relax your body and mind and help reduce stress. So with it, laying in bed and doing a body scan where you tighten and relax, and just kind of going through the body and doing the breathing. Some people do it with food. So if I'm having some bad pain, I might put a mint in my mouth and just feeling it and tasting it and concentrating on that, I can kind of lower a bit. But mindfulness for me actually sometimes raises my pain level. But it's what works for you. So there are several apps and programs available, and I know myself, my local community health center provides a weekly Facebook group. So from home on Facebook, I can log in, I can click, and I can join the class anytime. Mindfulness meditation. So John Kabat-Zinn wrote Full Catastrophe Living, and with it, it talks about pain and illness and meditation, mindfulness. And he also wrote Where You Go, There You Are, which is just another book which talks about being in the moment. And then with it, there's this other book that I found was a good read, which was Heal Thyself, lessons in mindfulness and medicine. And they found that when you can just be in the moment, and that you can actually reduce your pain. And then there's 2 great books by Tony Bernard, How to Be Sick and How to Wake Up. And this is about, how to be sick is accepting your chronic illness, and also for your caregivers. And then how to wake up is basically how to navigate joy and sorrow. And I found Tony was great because she also lives with chronic pain and a chronic illness. So she's able to put it in a way that brings it home, that you're not alone. So the next thing, cognitive behavioral therapy. And cognitive is how you think, and behavioral is how you act. And they suggest that your thoughts about a situation affect how we feel, emotionally and physically. So, some reason they think that we can cognitively, because, pain's all in our head, change the behavior. Unfortunately, research has now shown that cognitive behavioral therapy has little benefit for chronic pain sufferers. And I know it's a go-to by medical practitioners to encourage us to do cognitive behavioral therapy. It may help you deal with other situations in your life. I'm not knocking that, but with it, it's not going to benefit, or has little benefit for chronic pain sufferers. And now my favorite method, which is tell your pain off. Think of your pain as an alarm. When it goes off, goes beep, 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 high alert, my shoulder's hurting, acknowledge the alarm. Okay, thanks. I heard it. Turn off the alarm. If it's still kind of bugging you, acknowledge again. Hi. Yes, I feel the pain in my shoulder. It's not life-threatening. It's not falling out of the socket right now. It's just a little sublux. It's fine. Shut up. And if it continues, feel free to tell it off. Get colorful with your language. I get mad at my pain. I tell it off. And I use every swear word in the book. And you know what? I can turn it down. I can turn it off. And I just watch for little ears. And then I add distraction after turning off the alarm to help keep that alarm off. So I may play cards while I'm watching TV. So I'm doing, Sudoku and watching TV. Reading with the radio on. So there's a couple of things that are sending other messages to my brain, and I can keep that pain one turned down or turned off or muted. Might be a better term for it. Remember peer support. Build your peer support network. Family. They may experience similar issues. So my sister doesn't experience anything really with EDS, but her daughter does. And we have similar issues with food allergies and dislocations and subluxations, and so we're able to support each other. And there may be other family members that are in silence and don't communicate that they're living with pain. It wasn't until I shared my journey with my aunt that I found out that my grandmother was living with chronic pain all of her life and what she was doing to manage it every day. So with it, we need to be there for each other. Friends, with or without EDS or other chronic diseases or chronic pain conditions, they may understand what you're experiencing and able to help you with finding ways to cope. So I have a friend with lupus who also has chronic pain and arthritis, and she shares resources and I share resources with her, and what may work for her may work for me or may not work for me, and vice versa. But we're trying to make the journey better for the next person. So the next one is social media, online support and resources. So every time someone in our would would share information, like here's a medical journal article about POTS, here's an article about mast cell, here's an article about Skin issues, lipedema, and EDS. I would save all those on my computer by the health topic, and I saved it on my USB key. But with it also sharing who to go to. The other thing is, though, recognizing sometimes you need to take steps back from social media, because sometimes we get so engrossed in what's happening with EDS, we tune out other aspects of our life. Support groups are key, being able to learn from each other, support each other. And then there's also the ILC wellness sessions, where you can have a session with a peer person, a navigator that is an ambassador for wellness, that is sharing their journey, what's worked for them, and resources and connections, and helping you navigate. And some of those sessions are done with occupational therapy students from McMaster. So with it, you're getting a student that can also tap into other resources as well with the navigator. Social prescribing. So social prescribing is a global movement of people bringing community capacity. Let's build our community, let's strengthen it, and healthcare services closer together to directly address the social determinants of health, from loneliness to social isolation to racism, ageism, to income and housing and more. So with it, example in the EDS community is the advocacy work for equitable access for EDS and heritable connective tissue disorders and all its comorbidities, and access to neurosurgery. So that's me at a Rare Disease Day that was done in Barrie, and I was sharing my rare diseases and trying to build knowledge, but also build supports. So the what ifs. So we all need to think about our what ifs. We need to plan for the bad days. So alternate means of transportation. Is it a community volunteer that drives you to an appointment? Is it public transit, a friend, or going alone in a wheelchair, such as I've done? So this is my wheelchair, my old one, in the back of my truck. So I have a lift that puts it in. I can load it, I can walk. But if I'm having a really bad day and I have to take my pain meds, I'm not driving my vehicle. So with it, if it's an appointment in town, I may just wheel to it. So thinking about, okay, if that appointment is at 10 o'clock and I got to leave by 9, and plan A is I'm going to drive myself, plan B is, it's another it's 30 minutes away, I'm going to need somebody to drive me, so I'm going to have to call for the wheelchair bus, or I'm going to have to call for the community driver program. So looking into those things in advance. The other what ifs, planning for the long term, such as moving to a more accessible housing or renovating for accessibility. And so there's my part of my new bathroom. With it, we needed to replace some components of our bathroom, and we decided to make the changes for the long term. So with it, I have all the grab bars, I have a space that I can actually wheel into the bathroom with my wheelchair. Bracing and taping, so with it I've been shown, I know where I can find videos so that I can also tape something if I haven't taped it before. And I have a neighbor that's willing to pop over if I don't have someone to help me to do it, to help put the tape on. Meals. I know all of us have heard the spoon theory, and you need to think about, if you don't have the energy to cook, what are you doing to eat? And I know it's so easy sometimes to think about calling, ordering online, food delivery services, but think about your nutrition as well. So with it, when you are well, can you cook once and eat twice by getting containers that you can pop in the freezer so that you have a meal to heat up later in the week or a month from now when you're not well? Meal programs, so Meals on Wheels. Some hospitals have flash frozen meals that you can purchase and pop in your freezer and just take them out when you need them. And so that way there you're not getting as much salt, unless you're a POTS person that needs the salt, which you'd get in a lot of the frozen meals that you get at the grocery store. And then think about shopping programs. So delivery of food and knowing what's available if you need it. So one way to find things is 2-in-1. So explore community resources through 2-in-1. It's free 24/7 phone call. They have a searchable website. It covers health and mental health services, newcomer, immigrant, food banks and meal programs, housing, shelters, utility help. Nothing worse than discovering that, with the hydro hike, that you can't cover your hydro or your utilities. So with it, there is programs available. And with it, if you are home all day and you, as a result of your health, there is some programs that actually lower the rate for your hydro that are available through an application process. Looking into housing and home care supports. So myself, because I caused a bleed around my own spinal cord by popping a couple of discs in my spine when I went to wash my back, I have personal support workers that come in to help me with the shower. And because my skin tears easily, they also do a skin check for any wounds and help me dress them. 2-in-1 also has information on government programs and services, parenting and family programs, supports, disability supports, and more. So with it, it's available in 150 plus languages 24/7. It's a free call, just 211 on your phone. You can also text them, and with it you can get help by email, or you can search. And 2-in-1, this is the Ontario one displayed here, but they are across Canada. So you can access that information across Canada, and it's a free call. So financial. Remember to record your travel costs to medical appointments for either reimbursement if you're on a disability support program for financial help, or claiming on your income tax under medical expenses. So for myself, all of my practitioners, with the exception of my family physician, are 30 to 45 minutes to an hour and a half away. So with it, anything over 41 kilometers, you can claim the mileage. That's one way. You can claim the mileage on your income tax at the rate that's set for your province. And with it, you can also claim parking, and then meals, etc. So it's good to look at the CRA requirements under medical expenses of what you can and can't claim. Apply for the disability tax credit. It not only helps you on your taxes, but allows you to start a registered disability savings plan. And if you are lower income, that plan from the federal government will actually give you grants and will do matching. And the matching is done based on your income. So if you're lower income, the more they give you. So it is great because once you turn 60, you can start getting monthly installments out of it. It doesn't affect your disability support programs, and with it, having that plan helps you when you get towards retirement. Look into programs that you may need down the road, such as assisted devices or medical coverage. With it, I have to constantly explore because I'm on Zolair because of my reaction to the histamine 2 blockers. So with it, that medication is $16,000 a year. So how am I covering that if my plan doesn't cover it? So I do a regular check every year. So now I know that the drug company will give me a discount on the drug, and then the government, and at least in Ontario, will pay a portion. So it reduces my portion to about 1/3 of the cost of the medication. Also assistive devices. There is programs that cover them. There is also assistive device cupboards in some communities. And with it, if you're unable to pay your 25%, if you're on a disability support program, most provinces cover that 25%, but if you make too much, there is service clubs and other organizations that can help. And that information is available on 211. Now, I think one of the most important things I'm going to share is the EDS vacation. We all need a break from EDS between the appointments, the gaslighting, the chronic pain. Well, you know what? So do your friends and family. They need breaks too. So in my circle, we have the EDS vacation, which is a cue to me that they need a break from the endless different shit. I said it. EDS, my other acronym is endless different shit that comes with EDS. Because no 2 days are the same. I could wake up today and can't move my neck because the discs in my neck have herniated, which they have in the past. It could be the fact that I can't get out of bed because my spinal cord injury and my back pain is so severe. Or it could be that I'm having a great day and I happen to slip on the ice and gave myself whiplash and now I'm in pain. Or I just found out some great new information about EDS. I know we're excited to share information we learn, but sometimes they need a break. So all they have to say to me is, I need an EDS vacation, Tammy. And I don't talk about EDS at all. The only way I can break their EDS vacation is if they tell me, or it has to be canceled because I have a medical emergency that I need assistance from them with. This helps in having the time out that we all need. So with it, I've called an EDS vacation where I don't want to talk about it. I don't want to do anything related to EDS. I need to look after me. So with it, I may be doing some self-care. I may be, pushing myself and going out with friends and having lunch out somewhere. I could be going to the Butter Tour Festival. Anything that gives me a break is something you need to be thinking about too. What gives you that joy? So caregivers. So we need to support the people that support us, our caregivers. So whether that's your parent or your friend or your kids. We need to provide consents to practitioners for their involvement and any limitations. So with it, I have it in place that it's my husband, and if he's not available, it's my children. Most provinces have medical power of attorney and financial power of attorney templates that you can download. So I know in Ontario there is the form, and you can type in everything you want and then just print it. Excuse me. Share your wishes. Have a knowledgeable person to support them with EDS info. So I have a friend that's having surgery soon, and with it, she has shared with me what her wishes are, and I am supporting her children who have her medical power of attorney in making decisions and will bring forward any relevant EDS information they need to know to make the decisions for her care. There's nothing worse than going for a procedure and then your wishes are not followed. And with that, it can cause a lot of issues in your family or with your friends. So having that conversation, and I know it's hard, but we need to do it. And identify the caregivers and include them in your care team. So with it, I have a meeting every year with my home care case manager, and we have a conversation about what's happening in my care, what help I need, what supports I need, how they need to accommodate me with my EDS. And with it, I also use that as a cue to have a conversation with my family. So that way they know what I want and what I don't want. Okay. And caregivers can become isolated, overwhelmed, and experience anxiety while they are supporting us. Encourage them to seek support. So with it, I have connected friends with EDS, their spouses with other spouses, so that they can connect with each other and support each other. But there's also resources available outside the EDS community. So the Ontario Caregiver Organization, for those in Ontario, they have a website 24/7. They can call, talk to people. There's resources that are available on the website, tools, and the numbers there. It's a toll-free number. So with it, let's be kind to our caregivers. Make sure we're giving them the support and the resources and tools that they need as well. So, thank you, merci, miigwech. As a fellow zebra, thank you for advocating, educating, and supporting each other as we make this healthcare journey better for the next person, our children, and our grandchildren. And I hope you all have a pain lesson day.